Hi, my name is Brad Hufford, and I'm moderating this panel talk with Deborah Rosenberg and with Amy Upton, who are both mothers of adult children who have OCD. I will be posing questions to them later in the talk about their journey, their family's journey through the whole OCD treatment process, how they sought treatment, and what happened with their family in the process. So at first, I want to let them tell a little bit about themselves and their story. So, Deborah, would you like to start?
Sure. And thank you for having me join you. I'm happy to share my story, and I'm also happy to be in contact with any of you at a future point, should you want to speak with another parent who's walked some of your shoes. My son Alex is 18 years old, and he's about to start college. But we never thought that he would go through the struggles that he went through when he was 10 years old. His symptoms started so insidiously that it was hard to know exactly what was happening. I'm a physician and a medical educator, and I had done research on OCD in college, but I didn't even know he had OCD. He would yell and scream when he was working, and he would just get so upset. We thought he was anxious, so we took him to a psychotherapist, which he still gives me a hard time about. His yelling worsened. Then the repetitive behaviors started. Some of his tics just seemed so unusual that I thought it was a weird kind of OCD, but then it sort of started to declare itself. So I had worked summers at NIMH in child and adolescent psychiatry branch, so I sort of thought this was what was happening, but I wasn't prepared for the jumping, the hopping, the jumps, like jump through the things in school, jumping down the hallway, zipping and unzipping the notebook, crying and screaming when he would have to brush his teeth. So based on all of that, I finally figured out this was probably OCD. And then we had the struggle of how the heck to get this child therapy. And we live in a major metropolitan city. So I remember one night literally just Googling psychiatrist child OCD and making phone call after phone call after phone call till I finally found someone who had a message. Well, if this is an emergency, call this number. And I thought, well, if there ever was an emergency, this is one, because my child won't eat and he won't sleep and he won't walk in a line and he won't drink his milk. So I called and we saw him that night and got started on medicine right away, but we certainly needed psychotherapy as well. So we did find a wonderful psychologist who started him on the appropriate therapy for OCD, which we can get into a little bit later. My overall thoughts on some strategies that could be helpful is recognize that OCD can take many forms and forgive yourself for mistakes that you made. I still only get a hard time every once in a while about this psychotherapist that we went to. You're trying to do the best you can, and sometimes things take a while to declare themselves, and situations change, and with new information, comes new thoughts, which may be more appropriate. If something's not working, try something else. I give it a good try, but don't stay with something that's not working if your child's behavior is worsening. Um, Medicating your child is a big step, and maybe we'll get into that a little bit more later as well. It was not one that was easy for us to take. I don't know why it seems so different to medicate. I prescribe medications all the time. I'm an internist, yet something seems so different about this for a child's psychiatric disorder. I wished I'd done it sooner, but again, there's pros and cons, and there's a lot of perspectives about this, which I appreciate. But approach it with an open mind. Um, be mindful of siblings. Siblings need attention too. Alex's sister could have used a little more attention than she got those couple months when we were figuring stuff out. Try to be one with your spouse as well. Our family was pretty good with this. My husband was good at deferring to me, and the night we drove him to the psychiatrist, and I was like, we're doing this and he needs medicine. And my husband said to me, are you sure? And I said, yes, I'm absolutely sure. He was like, okay, go. And that was that. But sometimes that can be an issue of contention where you're going with therapies and what's happening. So you want to try to find a way to be on the same page. And sometimes both spouses maybe just need a little more education so that they understand stuff better. So that's sort of a brief overlay of what our experiences were like in a nutshell. He did get much better. A couple months, his onset was so fast and his getting better was so fast. So we thought maybe he had some variation of PANS just due to the abruptness of everything, which we can also get into a little bit more later, maybe. He did start to get better, and he did better in school, and he stayed on track with everything, and he's heading to college in a few weeks. So it's good, but he's heading to college on medicine with a psychotherapist with OCD, and knowing that this will be part of his life journey for whatever that means. And now I'll be interested in hearing Amy's story, and there'll be, I'm sure, some similarities and some differences.
Well, I'm delighted to be here. I really hope that people who do listen to our parent perspective will feel free to get in touch with us and ask questions. That was something that was missing, I think, for my husband and I as we first chartered this uncharted territory. Our daughter, who's now 35 years old and has two children, a 2-year-old and a 7-month-old, of which we thought we would never see the day that would happen. But this has been a 13-year journey, and I'm going to start at the beginning and walk you through the ups and downs of our experience as parents of a young woman who was diagnosed at 22 years old of OCD. So in high school, we started seeing some unusual behaviors in her last couple of years of high school. She started to sort of act in quirky ways that we just thought were quirky ways. She had lists upon lists, and she had certain rituals when she would drive to school herself senior year. We noticed that it would take her a very long time to read her homework, which we thought was unusual because she'd been quite a fast reader as a elementary school kid. And in her words, she said, well, as a child, the first symptoms I remember were around getting ready for school in the morning. I had a lot of anxiety around getting dressed in general, and I kept detailed lists of what colors certain classmates wore on different days, and used the list to generate a number which would then determine what color I was going to wear that day. I would also use counting to determine how to fix my hair, depending upon what day it was. In addition to these rituals, I also kept my room very meticulously organized. And when I would have play dates, I would keep mental notes of which toys or books were moved around so that I could fix my room afterwards. So this was going on in her experience, to which we as parents were totally oblivious. We just found her to be an organized individual who, had a little quirky behavior. Then she did go off to college, and we noticed that she was having some trouble staying in touch, which was quite unlike her. And as she described this, she said, the more OCD symptoms developed around my schoolwork, I became even more particular in college about my handwriting being perfect and began to use rules in completing my assignments. I also began to reread assignments in order to be sure that I understood and had paid attention to each and every word and sentence. Slowly, my homework took over my school time and my after school time. And as I attended difficult schools, neither me nor my parents were overly concerned at this point in time. We did notice in college, as the first 3 years went through, there were behaviors that were unlike her that we began to notice. But because she was producing, great grades at school, we didn't think much about it. Then she said, I started to fall behind on homework and assignments. I was very concerned with doing problems in the right order And if I made a mistake, I would rewrite the entire page of problems or assignments. It was not only time consuming, but I fell further and further behind. That's when, in her senior year, a tragedy did occur. Her roommate committed suicide, and she found her. And this triggered the OCD to a whole nother level that both she and us realized, because I moved down to her college campus. She wanted to stay in school and try to graduate. But then I got to notice almost firsthand, because she had not really been able to be honest with us about her condition and what she had been going through over these years. She was too embarrassed, too mortified to be honest, even with a relationship that we had with our daughter, which was quite close. So she said, during my sophomore year, I'd had my first panic attack about a chemistry class I was taking. I'd been up all night long working on problems and studying for an exam. I think my exhaustion and my stress made me start to hyperventilate, and I felt like I couldn't breathe. My anxiety rocketed, and I felt so out of control. This experience prompted me to ask and seek counseling for the first time in my life, we of which had no knowledge of this whatsoever in her sophomore year. I was prescribed an anti-anxiety medication to use as needed, and just having the pills with me made me much more relaxed and prevented a lot of anxiety about what I would do if one came upon me. But then during the junior year, prior to when the stress level just got so exacerbated, she said, I decided to live in a single dorm room by myself. This was a disaster of a decision. I had spent years hiding my obsessions and compulsions, and being alone and unobserved for most of the time resulted in an explosion of my OCD symptoms. My dorm became a minefield of piles and lists as I attempted to control every aspect of my life. I kept detailed sleep log and obsessed over how much time I was sleeping and studying. My life began to revolve much more around my OCD symptoms, and I even began missing classes for the first time in her life. So you can see, looking back and understanding why she wasn't sharing some of this. We had no clue what OCD was. We had never heard of it before. Forward, she did end up graduating, but she came home after college. She lived with us, trying to do some jobs. But unfortunately, during that summer after college, she experienced an increased desire to check things over and over, such as locks and light switches. She also began to experience a lot of worries and compulsions around cleanliness and the fear of contamination. She had a dog at that time, and she said she was constantly worrying about her pee and poo touching her tail and her feet and then contaminating the house and her family. She cleaned constantly. Her floors, anything that the dog touched, the laundry she became obsessed with the laundry. And by the end of the summer, she was afraid her whole house had been contaminated. And she was just so depressed and anxious about touching anything that she refused to touch the floor. And this is when we realized that something was much greater than we had thought. And she was on the couch and she wouldn't get up off the couch. And that's when I said, Meg, it really seems like we need to call. And that was the call we made quickly. We got her into a residential place in Baltimore, Sheppard Pratt, not knowing what it was. She was diagnosed rather quickly by this point in time at Sheppard Pratt. And then she went on she stayed there, had residential treatment for several years, in and out, and with an outpatient Sheppard Pratt retreat center. And then her doctor said it's time to go to the McLean Institute, to the OCDI. And she was treated there, and her path began to improve, and she began to understand a lot of the treatments that we'll be talking about, and respond to some of the medications that she was on. And I'll stop there.
Very good. Wow. Two two very different journeys that these two families had, but there are some commonalities between the two of them. Now I'll pose some questions to the panel and see if we can get some more information from them to help you in your own journey. What's one thing that each of you would have changed about your family's journey with OCD? If you had to pick one thing.
I would have done stuff sooner. I would have tried to realize what was going on sooner and not had, I mean, it all was very fast and scary, but I would have, I would have gone to medication sooner because it worked so well and I was hesitant and reluctant, and I would have tried to find the proper therapy and the proper treatment a little bit sooner. I think that would have been helpful.
And I think I definitely would have moved Meg to the McLean Institute sooner than we did in looking at what occurred. I think she also had, depression and anxiety with her OCD, and they were trying to manage that and getting her to a plateau so that they can, then allow her to learn some of the treatment specific for OCD. But I do think both our husband and I also wish we had probed and asked more questions to Meg. Looking back, of course, always is 2020, but in high school, we did know there were quirky behaviors, and by college, we noticed more quirky behaviors. And there was quite a bit she was hiding from us. But perhaps if we had asked, we did not start reading about OCD until she was diagnosed, and because we didn't know what it was. So I think I would have, started to read a little bit more than I did at the time that she was, showing some of these behaviors, and perhaps that would have changed her path.
Yes, OCD can be a very secretive disorder. That's for sure. What's one piece of advice that you would give to parents of children or adult children, young children with OCD?
There's a couple things that we did that I would definitely advise. And one is with the school and one is with the therapist. So with the school, I wish that everybody would do this. This was so helpful. So first we had a meeting with the school when he was deteriorating. And I told my husband, I was like, you have to come to this meeting because if they kick him out of his high level classes, that's just going to demoralize him. And that's not what they were trying to do. They were just like, how can we help him? Like the teachers are crying, the guidance counselors crying, everybody's crying. They're like, we had this kid and now he can't even write a sentence. But so what we did was we talked to the class and we talked to the kids, Alex and I together. And Alex was happy to talk to them. He's a talker. And we explained to them, this is what OCD is. Alex has it. This is why he does these weird behaviors that are so I'm coming to talk to the class and we're all like, where's Alex? Where's Alex? And then we start seeing the hopping. I'm like, oh, there he is. So just sort of explaining like, why is the hopping? Why is it taking him so long? And talking to the kids and helping them understand, I highly recommend that, and helping the teachers understand and how they can help and how they can make things less stressful. And after we did that, I got some emails from parents who said, our kid, let us know, tell us how we can help him. It was so nice. Nobody teased him at all. And the kids helped him. Like they were seeing he was having a little trouble getting from class to class. Like they were helping zipping up his stuff and helping with the stuff. It was sweet. Like they really helped him over the hump. So if there's a way that you can talk to your kids' classrooms, do that. The other thing that I think was really helpful was when he was doing his therapy, I met with a therapist by myself to be like, hey, okay, I know you're doing this with him. Tell me what I need and what we need to be doing at home that's not accommodating this and that's going to help him get better. Like when he's like, Mom, is this food okay? Is this food okay? Is this okay? Is that okay? You know, what are we supposed to say? Like, give me the language and give me the words, and let's make sure that we're doing this right too. So a separate appointment with separate time with the therapy, I think, is a very helpful thing. So those would be my 2 tips.
And I think both my husband and I would say that we were a little fearful to bring up candidly with our daughter some of the things that we were observing. So I think one thing I would change is that perhaps, you know, the way we asked questions about what was going on. She is a sit back and observe kind of kid and always has been. So she really didn't offer up much at all. And because so many things were going on, we now understand how embarrassing that was. But I think there were ways that we could have been both better in touch with our therapist, asking direct questions. And we took the approach, the therapist is in the driver's seat. We are here to be the supporter. But I think we could have been a little more proactive. And also with Meg, you know, the quirky things that we noticed, instead of not bringing them up, which I think at the beginning we did not, it would have been probably better to address those things.
And I think it must be so hard when the kid's older versus younger. Like when they're younger, you can control a lot more. Or we would see stuff,
Yeah.
and especially his younger sister, she'd be like, Alex, that's OCD. You know, you're doing this and this is OCD. And Alex would be like, okay, fine. You know, but he was young. He was like, when they're older and you want to give them their autonomy and respect their autonomy, I just think it must be so much harder.
Gets complicated.
Yeah.
Yeah. Never
Because
thought.
OCD is so tricky, as we come to learn, and that it attacks the very things that you love. And that's, you know, there's that very fine line about, you know, wanting to talk about leading your life through your values, but when they're 22, you know, through 35, you know, they're trying to figure out what those values are. And so anyway, it is a tricky disorder.
Yes, that it is. What's been your child's trajectory, the course of of their OCD? What's been the trajectory of that, and have there been flare-ups? And how have you handled those?
Well, so initially he was treated and he did get much better, and that was really nice. And so he was 10, he was in 5th grade. Over the next couple months, he got better. And then there was a nice period, a couple years, and he felt better and he did better, and that was good. But this was on medication, which in my opinion, he'll just be on it indefinitely, and that's fine. I'm too scared to think about what might happen if he goes off of it. So we just won't have that happen. But there was a depression relapse, and his initial diagnosis, everything was bad in December. And this depression relapse was also December. So as he heads to college, I'm like, well, we got to watch out for the winter time. And we will be mindful of the winter, but there was a relapse, and he was enough to know what's going on, and, you know, let us know. We could just observe him and see what was happening. And we needed to up the medicine. And I think the dose that a 15-year-old needs is not necessarily what a 10-year-old needs. So that what was a relapse. I think we were ready to jump on it a little quickly to notice that there was a change. And now heading to college, I'm just like, can you tell me if something's changing? And he says he will. We hope that he will. But so that was the mostly better little stuff. And then there's certain periods where we just see a little uptick in some behavior. It's just like a little kind of uptick, and then things kind of settle out, and then there's a little uptick. And that's sort of where we are now in this kind of ebb and flow.
So our daughter has had definite ups and downs, ups and downs. There has been, you know, a gradual improvement over time. She did hold down several jobs after she graduated from McLean Institute, and she had to sort of experiment with telling her employees that she had OCD or choosing not to tell employees that she had OCD. She had difficulty getting up. That's part of her OCD condition. Sometimes when she gets stressed, she can't get out of bed. And so she would have to explain why she was late for work. They would obviously keep track of that and address it with her. We've had to she's had to try different ways with employers to see what works best. She has lost jobs because of her OCD behavior, but she's also held jobs, with different, she's had therapy all through these years now that she's 35. She still has her bad days. She still has OCD thoughts and compulsions that plague her at times. They're spaced out further between episodes. But she looks back and she does remember now that her whole world was confined to one couch, one safe couch at one point in her parents' basement. And that gives her a gauge by which to measure some of her progress. And she still talks about that. And she now looks at herself, and when she has high stress periods as a mother, sometimes she shuts down and she stays in bed for a day or two or three. And she's managing this with her husband, who had also not been familiar with OCD when he started dating her. And when he married her, he did know she had OCD, but there's a difference between living with it and sort of cognitively knowing about the condition. And they're working their way through it. She continues to get help, and she continues to have highs and lows, but she's beginning to realize, what she has to do for self-care and what she has to do to lessen these episodes. She did have a flare-up after her second child of OCD with postnatal, with a depression that then catalyzed some of her OCD rituals and behaviors. But she got help immediately and slowly worked her way. She's had a setback, but she came forward. And so now that she's through the first 7 months, she's feeling much better. Part of that, of course, we do have information on the IOCDF website about postpartum OCD. So I would definitely recommend, to people who have this, to be part of their life journey, to take advantage of some of those assets that I think these organizations offer to people.
Yeah, and I think, and we keep talking about life journey, and I think that's the thing about OCD is this is a life journey. I mean, I feel like, and and Brad's the expert, but with some conditions, it's like, okay, we'll treat your strep throat, you're done. We treat this thing, you're done. I don't think that's the way with OCD. I mean, you can tell me if you know anybody where they're completely done. For us, I think Amy and I've accepted this is a life journey, and they'll figure it out. We will help them, but this will very much be a part of their life.
Yes, as a psychotherapist, been treating OCD for 26 years. Definitely, it's a life journey. There can be some great times during your life. There can be times when the symptoms have decreased very significantly. But yes, it tends to be a disorder where the symptoms increase with psychosocial stressors, just like we just heard from both stories. So yeah, that tends to be the course of OCD.
One thing that I think Meg also mentioned that I find helpful in trying to be a more understanding parent and a helpful parent. She talks about, the guilt and sort of the hopelessness that you do feel when you're in the depths of grips of the OCD taking over. And she gets stuck, as we've talked about, in her own mind. And I think what I discovered that I hadn't been encouraging her with, just because I didn't know, I don't hold myself, in a terrible spot because of it. But it's being able to go back to that you know, what value do you now have? And of course, as those decades now, a whole decade and plus has gone by, she values her family and she values her children. And you begin to have, you know, things that really mean a lot to you. So when the OCD attacks, she is definitely more driven, you know, by those concrete things in her life, like a job. I mean, yes, she lost several jobs, but she realizes, you know, that's what I have to keep working towards, is that I'm not my OCD, and I want to live my life the way I want to live my life, and trying to really tamp the OCD down when she can.
And that's important. I think them having a sort of, it's almost like a mantra or something. Alex decided to make a pamphlet for his high school about his OCD and what people should recognize. And his thing always is, when I'm in the depths, and whenever I'm in my depths, I just tell myself it does get better. Life does get better. And he's like, no matter what, and even when the depression thing happened a couple of years ago, he's like, life gets better. You got to just keep believing that. So I think if you can truly believe that in your heart, then it's a very helpful thing.
Absolutely. Yeah. And depression is often comorbid with OCD. There's about a 50% comorbidity between the two disorders. So
50%. Wow.
yeah, 50%.
Okay.
Yeah.
Okay.
It's a high number. And it's depressing to have OCD,
Mm,
this kind of anxiety attacking you. So
yeah.
yeah. What has your experience been with medications? What have your children's, the OCD sufferers, experience been with taking medications, and what have been their fears, and what's been the actualities?
So for us, it's been just really positive. I mean, it was our way out. And when he started, when the things were really bad, he was started on Zoloft, which is sertraline, and on a slow, gradual taper. But he was also started on a tiny bit of a benzodiazepine, just because the SSRIs like Zoloft can take a couple weeks to kick in, and this was just to just calm him down. And things were so bad. We literally, it was 11 o'clock. We get the prescription from CVS. I'm like, Alex, sit down. You're taking this pill in this chair in CVS. And he did. And then by the time he went home and went to sleep, he was like, he's like, this is like being in Disneyland, but being happy. So but that was, that was out of him. So then, but it did, like, it kicked in, and it was a couple weeks, and then he really started getting better. Then there's this disinhibition thing that can happen with the benzodiazepines like Ativan, and suddenly in school weird stuff's happening. Like, he was saying words that he would never say. There was so we talked to the therapist. He's like, I think he's having some disinhibition. We need to get off of the Ativan. So he got off of that very quickly. But then since then, like I said, we did have to increase the dose. Some people stop medicines at times. I've heard. Then there's this lore that if you do that, then when you restart on it, it may not work as well. That's not something we're going to chance. And maybe I'd feel different if he was like a female of childbearing age. If then maybe there's pressure to get off the medicines a little bit. From my vantage point, it works so well. He's doing so well. I'm afraid to ever stop it. And I know it's so chronic. So that's sort of how I feel about it. But perhaps Amy has a different take.
Well, Meg being diagnosed at 22 years of age, she has chosen most of the decade and plus not to share with us what medications she's taking. And that's one of what Dr. Tom Insel, who has written a book recently called Healing, that as the director of the National Institute of Mental Health, and then also as a physician and a doctor. And I think the communication between therapists and family members, it could help, it could benefit the patients, I think, to make some changes to be able to share some information more than has been the case the last 4 decades. And that's one of the things Dr. Insel does push for. She's been on 4 medications at a time, varying degrees of medication. We do know that, and they have varied it quite a bit over the decade, and tried different, amounts and different formats. It has seemed to have helped her. We have not felt like, it has caused more problems.
Awesome. Amy, you're freezing. Let me text her. I'll text her and let her know that she's freezing because I'm very curious to hear what she's going to say.
Yeah.
Um, with your kids, just of how susceptible people are to medicines. And I, as their mother, am very susceptible to medicines. I take very small dosages of things because I am impacted heavily. And I think Meg is that same way, which has perhaps made it difficult to find the right balance of anti-anxiety, depression, and OCD medicine.
Okay. The medication, it sounds like, has been useful. Maybe not a panacea, but certainly in Deborah's son's experience, very useful. I think that that's the case with most people. I think most people experience some benefit from the medication, but other people may not. It's sort of goes
Mhm.
that way with OCD and with the medications right now that are used mostly. So it's it can be frustrating, but it also can be very beneficial for people.
Yeah, I mean, I guess, and my advice would be be careful if you're going to say, no, I would never medicate my kid. Just caution with that, because really, we would medicate other illnesses. We're not going to let our children suffer with diabetes. We're not going to let them suffer with high blood pressure. So why are we going to let them suffer with a mental illness? We went with a physical illness. So caution in that. Just have an open mind, maybe read a little more. And I mean, if it doesn't work, then you can stop it. There's not, we're talking about these serotonin reuptake inhibitors, which is the main class of medicines for it. If it doesn't work, you can stop it. There's not going to be like permanent long-term sequela because it wasn't a great fit for your child.
Correct. Yeah, I agree with that. Okay. I was wondering, and Deborah alluded to this, but how does this affect the family unit, the other people in the family, and how does OCD affect the functioning of the family, and how do you pay attention to other people's needs? How does that work with OCD?
Yeah. Amy, you want to go first on that one?
Meg has a brother who is 4 years younger than she is. And I think it affected him in that, when we made trips as a family up to Baltimore when she was first sick, he was so unfamiliar, just like we were with any of this arena, because we'd not experienced it or been exposed to it before. They have a very close relationship. They're opposite sex and they're 4 years apart, which tends to be a very, a positive experience. And I think it's impacted him. They continue to talk about it and be pretty open about it, which I think has been very helpful to Meg in particular. Perhaps it's been harder on Stephen than it has been on the sufferer, to watch his sister, go through some very difficult years. I think, had an impact on him. Fortunately, I think it's been in a positive way. He's much more open to mental health issues of his friends. And of course, he has friends who have ended up, severe depression and anxiety disorders. And it's much more talked about in today's world. I think the best thing I have done, and my husband as well, is that we do talk about it as a family and we do open up and try to express how we're feeling about what's been happening. And I think that's been most helpful. I think the hardest part for Stephen is that, he realizes that she has this and he doesn't, and he almost feels guilty, that he has this life that seems, perfect without these issues. And I think, we try to, talk about those things. That's about, as good as we can with the situation at hand.
Yeah. I
Yeah.
mean, I think for us, his younger sister's 3 years younger, and she was kind of his safe space a little bit. Like he can be himself with her. And so his symptoms had started the end of that December. Mid-February was President's Day weekend, and we had a trip and we were at the pool and they were just playing so nicely almost before he even had it. Like he could just have his tics with her or not have his tics. Like no explanation was required. And so that was really, really nice. On that same trip, though, he played golf with my husband, which seemed like the longest golf of his life because of the swings. It was just like, no, 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 no. I got to do that again. I got to do that again. And they came home from this golf tournament, and I think just golf playing, and I think it was a long day. But family ideally should be their safe space. I love the idea of kids being able to talk about it with the family unit, so it is their safe space. And I think they should be encouraged to be open with it. Alex has done a lot with the OCD Society. He says some kids say that when they're taking their medicine and other families around, to say, oh, it's your allergy medicine, and sort of things like that, and the kids feel bad, like they feel very kind of stigmatized, like there's really something wrong with them. So I think it's definitely affected our family, but just this is something that we deal with. And I think you do want to make sure other siblings are getting private time with each parent and that they're getting attention, because it's so encapsulating that behaviors take over the house and the attention and the
Yes.
oxygen. So the other children need their oxygen too. So I think that's something to kind of be mindful of. That can happen, but people adapt to what they have to. I think that's so interesting what you said about your son feeling like guilty. I'm like, gosh, Jessica would never feel that. Like she's more like in a self-absorbed teenage spot that she would never feel like, oh, I feel bad I don't have this, and Alex does. She'd just be like, oh,
Well, Stephen, remember, was in college by the time
Yeah.
she started it at,
Yes.
McLean Hospital. So it was a
Yeah.
different age bracket.
Yeah,
Yeah.
these ages are so development. There's just things you see.
Yeah.
Yeah.
Yeah, I mean, we would just name his tics, or Jessica would be like, that tick, I do not like that tick, or this other tick. She'd be like, that tick is a really funny tick. And she'd be like naming his tick. So I guess it took some of the like pain away from it. It was just
Interesting.
Yeah.
Personalities do enter into it, the types of personalities that each people, bring to the table, whether it be the parent or the,
Yeah.
you were talking a little bit about your husband. My husband, of course, had to be gone a lot because of his work. And so I was the one who was sort of the primary. But of course, he was very, it was difficult because in our case, he knew even less about psychology and sociology and sort of some of these brain disorders than I did from the beginning. So we had to bridge part of that gap as a, parent just wanting so to not see his daughter who he loved in such pain, but not really understanding because he wasn't able to be in a lot of the meetings that I was able to be in. So there is that pressure, like you talked about, between parents of children with OCD and between siblings of children who have OCD. It's a big challenge.
Yeah, one thing I wanted to mention was that Deborah has talked about tics, and tics are often a part of OCD. There's even a form of OCD called Tourettic OCD. So just to
Good
clarify
point.
Yeah.
what that means. tics are often sort of seen in Tourette OCD as a compulsion, serving the same
Category.
function as a compulsion. Or people can have tics separate from OCD, but they often co-occur too. One piece of advice as a therapist that I had for sufferers was to certainly go to a specialist. Go to an OCD specialist. There are many people out there who treat OCD, but there are many subtleties, nuances with treating OCD that you learn as you treat people with OCD. So I would certainly suggest that people really really seek a specialist. And you can I know that the IOCDF has a resource, a list of members who are specialists, or at least they're members, but I think most of them tend to be specialists, and you can ask questions about the experience that they have treating exposure and response prevention therapy, which is the gold standard therapy in OCD, together with the SSRIs for medication. So ask for ERP treatment, exposure and response prevention treatment, and what their experience has been in that regard. Was there anything else that either one of you wanted to say before we had to stop?
I guess one last comment I would make is that, when I finally understood as a parent to not be sort of telling my daughter, look to the future, look to the future. I kept wanting to get past the present and, to have her move on almost. Once I realized that really her OCD pulled her into, searching for perfection. I mean, that was where she really got stuck. And I didn't understand for too long, to tell her not to suppress her thoughts about her OCD, but to accept those OCD thoughts almost, and then to move, through them as you're taught in ERP, I think, and to move forward, one step at a time. So really living in that present, not just suppressing it, but really trying. And once I got that, my coaching, became better. But it took far too long as a parent, and I think both my husband and I, we're struggling how best to be helpful, like you do feel as a parent. And you're trying to get it, but you don't fully get it because you don't have OCD and you don't really understand it. And so I think I'll end on that note, that for parents who are maybe starting a new diagnosis with a child with OCD, is, one, speak up to your therapist and really ask the questions. Whereas I think we were reticent to do that. We felt the therapist was in charge, and even though I read a ton about it, I still didn't understand it. And I think, having the opportunity to be around other parents who have had children with OCD, going to the conferences, if you're able to do so, really does help you to begin to really grapple with, that it is a brain disorder and the brain goes awry. And there are ways to walk towards freedom, like our daughter has felt. And, she is my hero. She has really fought the good fight, and it's showing in her life. So I want to encourage all of you, ask questions and do the best you can do, and try to use the resources that are available.
Absolutely. Yeah, I totally I agree with all of that. And it's also really, really helpful for children to see that they're not alone and that there are other people with OCD. And I mean, we're not trying to like be an advertisement for the OCD Foundation or the OCD conferences or anything, but just going to meetings and going to sessions for Alex to see that there are other kids like this. I see this in the other kids too. And the parents, I'm not the only one. I'm not, because at their school, they may be the only one, but they're
Right.
not. But then they go to these and they see there's lots of people. And that can be really, really helpful for them to see that they're not alone, and then just accepting, okay, the life journey will be different, and this will be a child who will be very sensitive to other people's needs, and this is going to be a child who's going to recognize other people's pain and other people's needs in a way that neurotypical children won't. And you know, so then we just go with it. But get help. If the help you're getting is not working, get different help and get support.
Okay, well, great words of wisdom from these two women who have had their own journeys and with OCD and with their families. So we hope that this panel has helped people, maybe has helped you learn how to best navigate the effective treatment for OCD, the OCD community, and that you can get the best treatment possible. So thank you very much for listening, and we'll see you later. Bye-bye.
Thank you, Brad.
Thank
You're
you.
welcome.
Bye-bye.